Well, good afternoon, everyone. I'm Steve Bryant of Nationwide's Prime Media Studios, and we welcome you as Nationwide Marketing Group presents the Employer's Guide to COVID-19. This is prepared by the firm of Constangy, Brooks, Smith, and Prophete, and it was arranged by Kelly Partridge, Nationwide's Director of Human Resources. It was created to help Nationwide's members understand how to best operate their businesses through the COVID-19 pandemic and how recent government regulations will impact their operations. It's part of Nationwide's COVID-19 suite of member support initiatives that include member advocacy, member compliance, consumer communications, and crisis merchandising and marketing, among others. We saw that more than 500 attendees have registered for this event, so we know this content is of great interest. So before we get started, we have Mike Whitaker here with some basic ground rules for the webinar.
Good afternoon, ladies and gentlemen. We'd like to welcome you again on behalf of the Nationwide Marketing Group. Just to give you an overview of how this webinar will work, we'll be turning things over to our presenters in just a few seconds. During the presentation and throughout this webinar, you will find that all attendees are on mute. However, you're able to submit questions through the GoToWebinar forum. We've got some questions coming in already, and as the presentation proceeds, we'll be monitoring those, and we'll be sharing those most popular questions, the most frequently asked questions, with our presenters at the conclusion of the information they have to share. If we run out of time and they're not able to answer all questions, we'll be sending an email after this webinar to address as many of those as we can obtain answers for. So with that said, we welcome you again, and I'll turn things over to Nationwide's Human Resource Director, Kelly Partridge.
Thanks so much, Mike. And thank you all for joining this afternoon. I am thrilled to have Jill Strickland and Timothy Davis, along with Constangy, Brooks, Smith, and Prophete, to join us. Jill and Tim are both partners within the law firm. Jill is in the Winston-Salem office, and Tim is in Kansas City. There is much content to review. So without further ado, I turn this over to Jill Strickland.
Hi, everybody, and thank you so much for having us today. We're so glad to be here with you to talk about this very timely topic. Questions are coming in already, and we hope to answer as many of them as we possibly can today. To start, so you have a face to connect with a name and a disembodied voice on a webinar, this is Tim and me. We'll both be sharing various portions of the presentation today, so you'll hear from both of us. Our agenda for this afternoon, I'll start by turning it over to Tim to cover some basics about COVID-19, the effect on our economy, the effect on our businesses, where we are now, and what we see coming down the pipe to the extent we can. We'll talk about some very practical workplace guidance and helping businesses navigate this health crisis. We'll cover the new Families First Coronavirus Response Act that was passed recently, as well as the guidance that we've received so far. There's more to come. And we'll talk about some workplace law and best practices, most frequently asked questions and some answers to those questions. And we'll include in that a discussion of OSHA and what OSHA considerations y'all should bear in mind as we work together on navigating this pandemic. And you wouldn't be speaking with lawyers, would you, if there wasn't some fine print? So I'd like to turn things over to Tim to talk about the fine print and cover the basics and the background of COVID-19.
All right, thank you very much, Jill. I assume you can hear me all right?
Yes.
Okay, good. Thanks everybody for joining us today, and I'll be very brief in my opening comments as much as possible. This is the fourth webinar I've done like this in the last 2 days, and total of about 3,000 attendees. So we're going to do our best to answer the questions you have today as they come up. But if we can't, I think I share Jill's agreement that send us emails or questions if you've got them to go forward. Our goal out of these programs is to make sure employers understand as much as we can cover on a call like this about the new laws, with the understanding that when we haven't been doing webinars like this for clients, we're actually talking with clients and about what they're doing. I have the sad distinction of being involved in the last 5 days with having laid off about or furloughed about 250,000 people via various clients. So depending on your industry, this is a huge situation, and the options you might be considering are very different than what different types of employers in different industries might be. So if we don't get covered today, know that we're available to help as we go forward. Unfortunately, the existing laws that we're about to talk about we're not designed to address the situation. The EEOC laws, the WARN laws, none of them were designed for what the world is experiencing right now. So this is something that we can update you on as of today, but things are changing rapidly. So one of the most important things you're going to know is the date on the front of this document, the very date that this was provided. It is up to date through then, but as I'm sure you all know, we are all waiting patiently or impatiently for the CARES Act, as it is called, to get voted on by the Senate. Literally, as we speak, they're in the chambers voting on it. After that, it will go to the House and then over for the president's signature. That is something that I wish they had done before we got covered, because it would have been great to cover. I am going to touch on that briefly because that will potentially have impact on all of you. But this program we're talking about is up to date only as of today, because things are changing so rapidly. So I encourage you to be open to updates and things as they come. So Jill, I am not seeing the program on my computer. I don't know what the reason there would be, but if we go on to the next slide that has COVID-19 at the top, that would be great.
We're there.
Well, when you look at this slide, everyone, I'm not going to spend much time on the basics, other than as we go forward, we're going to talk about what I call your day one plan. And that day one plan is, what do you do when one of your employees notifies you that they have tested positive, that they have symptoms, a close family member has symptoms, or somebody they've been in direct contact with has either tested positive or have symptoms. You are all going to go through that at some point in the next month, 6 months, year. And so these symptoms and how you react, I'm just kind of summarizing them here so that we can look at them in light of what you would do as part of your day one plan. Obviously, the CDC is the best source of information for this kind of actual information about the healthcare. But the CDC is telling us this as part of our social distancing. Stay 6 feet away from other people. This is primarily spread through sneezing or contact with other people. If you're in contact with other surfaces, like a desktop or a subway or a door handle, be aware that the virus it can live for up to 72 hours on these hard surfaces. So frequent hand washing, use of hand sanitizer, all that is greatly recommended. We don't have a vaccine for this. In reality, what we're hearing, and I'm sure you're hearing as well, because I'm sure you're as glued to the news as we are, is this virus is with us until a vaccine is developed, and that's likely to be 12 months to 18 months. I'll come back to that in a second, because that's going to be important. If we go on to the next slide with regard to symptoms, again, I'm not going to spend much time on this. Fever, cough, shortness of breath. They're even saying inability to taste or smell is an early sign of this as well, but the evidence on that is still preliminary. But it's a mild to severe illness. Most people, if they get it, 98% of people who acquire this will still survive. It is just that other 2% that the world is changing, obviously, to protect and make sure that we do what we can for those that we all care about, of course. So those are the basic symptoms. I'm not going to spend much time on that. If we can go to the slide now, all of you should be seeing a slide that's got a wave on it. I am not a scientist, and last I checked, I don't believe Jill is either. But the information we are getting is that this is going to have a business impact of 12 months. Our goal right now is to flatten the curve so that our healthcare system doesn't get overwhelmed with this. We have more time to develop potential things that help us with the symptoms, if not cure the disease. But it's to get us through the next 12 months or 18 months until we have a cure. The waves that we're trying to do by flattening out the one big one is obviously creating a secondary wave that is the economic wave we're all going to be experiencing, that Jill and I are going to cover at length today. After we get through this first wave, they are expecting there to be pop-up or whack-a-mole type waves of illness that go around the country for the next 12 months as the illness just reappears. So I don't know where everybody else is on this call, whether you're right at the hot spot right now in New York City, soon to be LA, soon to be Louisiana, those kinds of cities that are dealing with the peak right now of dealing with the virus, or if you're just getting ready for as the peak hits you, what do you do? Be aware that this is a long-term fight. How you deal with your business, how you deal with your employees, it is all something we are going to be managing through together over the next 12 to 18 months. So if we go to the next slide that says planning your business, again, COVID-19 is going to be around until we get a vaccine, or if we don't ever get one, until there's a herd resistance built up in the human race, where 80 to 90% of us have experienced this virus and lived through it, and then are naturally resistant, that would cause the virus to die out because there's not enough hosts available to it. That is what we're dealing with now. That is the unfortunate scientific reality. The current actions we're doing are to save lives, not necessarily what's best for businesses, and that is a balance I'm sure we're all comfortable with, but one that we are all making. If we go to the next slide, the gophers and a snake, this is what I am telling all of my clients when we're walking through and talking through this. This is going to cause a tremendous disruption as it enters your business as we go through the next few months, but it is something that will pass. There is a light at the end of the tunnel, to mix my analogies. There is an end to this virus for all of us. And what we're going to be talking about primarily is what Congress has done to help us get through this. There is going to be a $2+ trillion package passed today, the largest relief package ever in the history of the United States, in surpassing even the World War II effort that we went through, if you can imagine that in its scope. That is going to provide all kinds of benefit opportunities, which could help talk what Jill and I are talking about today, how you deal with your employer and your employees. So if we go to the next slide, how do we get through this gopher in the snake that all of you are dealing with? You cannot, after we get done with this call today, say, here's my plan. I don't have to do any more, just implement the plan. The laws are rapidly changing, and your compliance obligation, at least with regard to your employees, which we're covering today, is changing as well. So getting a plan together is great. Adapting that plan as new information becomes available or as the law changes is key. First wave, obviously mitigating this healthcare crisis. Subsequent wave is how do we deal with your employees and the items that will be available to you. And that is our goal that we're going to try and cover today. If we go to the next slide, in many ways, I think this is the most important slide on here, the trusted websites. There are great places out there to get information. And I think I'll plug our firm a little bit. The very bottom one may be the best, not because of just the content, but we are trying to update employers and our clients. We issue about 10 compliance updates a day at this point as new information is coming in. We also link to all of the other websites that you see above that ours on this slide. All right, I had to get a drink of water there. I'm losing my voice. All right. These websites are very, very good with respect to what they cover. The CDC is the best source of information for how to deal with health conditions. So when your day one comes up, what do you do to quote unquote sanitize and quarantine your workplace? CDC has excellent guidance on that. If you've got questions about discrimination or various things that Jill is going to be covering when we go to questions like, can we take a temperature check of our employees? Can we ask them about their health conditions right now? The EEOC website has great information on that. Perhaps the best one in terms of the new laws is the fairly long one right below DOL.gov. That has got all of the new questions that have been asked so far that the Department of Labor has answered with regard to the Families First Corona Response Act. And if anybody comes up with a good acronym or a good way to say that sounds good, that's just a hard one to keep repeating all the time. But that one has all of the Q&A that the Department of Labor has answered so far regarding those two brand new laws that just got passed last week. The bulk of the questions that are in that Q&A we will be answering today on our program. But if you need more detail or more direct information from the Department of Labor, that is a great website to do it. Other websites are available out there. One of the biggest challenges that I've been dealing with my clients so far is we're not doing well. We're not having any business. I just talked to a dental practice here in my part of the country. And because all non-emergency procedures have been advised to be discontinued at dental practices, they've got 14 dental hygienists and 3 dentists with nothing to do right now. They've got 0 patients coming in. So their questions are, do we lay everybody off? Do we not lay everybody off? If we lay them off, what's their unemployment going to be? How do we handle their health insurance during this time period? If we don't lay them off because of the new CARES Act that is going to be passed, will we get paid for all of the salary and wages if we keep them online, or if we furlough them and pay them anyway? These are the kinds of really existential questions we're getting from clients who are struggling with the lack of business, completely unrelated to a patient or to an employee getting the virus. But how do we deal with this significant downturn? For that CARES law that Jill and I are just not going to be able to cover in detail today, quite frankly, because it's not a law yet, is going to be a lifeline for many of you. In short, I'm going to cover it a little bit more later, but in short, that will likely provide everybody on this call, as long as you have fewer than 500 employees, with the opportunity to apply for a small business loan that is guaranteed by the Small Business Association that would cover your payroll and your mortgage, rent, whatever you have for your business, for 4 months. And that loan, as it was set up prior to the one that's there now, I haven't seen the final, would be 100% forgiven, which means you could cover your payroll costs. You could cover your expenses like rent and mortgage at no cost to yourself for up to 4 months. That is a huge lifeline for both you and your employees if you're going to try and continue operating, or if you can't operate during this period. So again, I wish I could tell you a lot more about that now. I can't, because they haven't released it, and it's just not even the law yet. So we're going to cover what we can. So that is the information about the slides. If we go on, Jill, quickly to the first wave, where are we now? Social distancing, hygiene is recommended. No gathering of more than 10 employees. Voluntary efforts, shelter-at-home quarantine. I am actually coming to you from a shelter-at-home quarantine zone in Kansas City, Missouri. I am at my office because we've been deemed to be an essential employer at this time, given the kind of guidance we're providing everybody. But I'm overlooking a city that is devoid of any activity where I would normally see 1,000 cars and hundreds of people walking around. So we're going to try and talk to you about that, of what happens if you go into one of these shelter-at-home or quarantine districts as you're out there. But that's where we are right now. And then where you are, you may as well be under those. And it's amazing, you can't understand what that means and how it can impact on your business till you do. If you are not designated a essential business, all your employees will not be coming to work if you go into one of these zones. And how you handle that is obviously going to become something that's very important to you. So the next thing, if we go on to the next slide, if you are operating, Jill, right now, I will tell you, we are in such a country that is in a state of fear. Your employees are terrified right now. They're afraid to come to work. They're afraid what's going to happen to their jobs if they don't come to work. They're afraid of getting sick. And each of you is going to have to develop your own plan on what am I going to do with my business to get through this crisis? What am I going to do if we go into a quarantine where nobody comes to work? How am I going to do that? But communicating with your employees during this time is just absolutely critical. You're going to need to take steps to make sure your workplace is as safe as possible. Practicing the separation of employees. I've talked to some companies that operate a call center, and they've actually tried to separate their cubicles and spread that out. And there's various things they do if they're still operating. How are you cleaning, sanitizing your equipment? What kinds of PPE might you have, if any? And for the most part, that is not recommended, as you know. Can you work from home? I closed our offices here in Kansas City 2 weeks ago, sent all of our attorneys and all of our staff home. We've been fully working from home for 2 weeks now. Do you have the technological capability to do that in your business, for some or all of your employees? But that kind of structure is something that if you're not doing it already, you will need to do. Jill, if we go to the next slide, the day one exposure. I wish I had more time to talk about this with everybody, but it is shocking to me how this is evolving so rapidly. 2 weeks ago, I had a client call in and say, we had a person that tested positive for COVID-19. We're closing our factory and sending 300 people home. That's not necessarily what the CDC recommends in this situation, but they did have to take certain steps, of course. If the employee has symptoms, Jill's going to talk in a little bit about sending that person home. If that person had contact with others, direct contact, not just passing in the hallway and stayed 10 feet apart and didn't touch and didn't do anything, then maybe you wouldn't send your whole office or whatever it would be home. You just make sure your area is sanitized and cleaned and notifying people that might have been exposed to that person. How are you dealing with that risk? I would bet there are people on this call, if you are like our other clients, who have had employees come to them and say, look, I'm at risk. I'm in my 70s. I've got a heart condition. I've got asthma, whatever it may be, or my spouse is. I am really uncomfortable coming to work right now and facing this thing. Can I just stay at home? And you're having to answer those questions. And so we're going to try and help you with those today. Some of you might be the flip side of that, where you've got people who are afraid to come in and you desperately need them and you can't let them stay at home. So those are real questions that all of you are going to have to face from a legal compliance standpoint as we're covering, from an ethical and moral standpoint, from a what can you do best from your employees and still survive standpoint. Because the last thing I think any of your employees want to do is to put your business in jeopardy and their jobs in jeopardy. So everybody's going to have their day one plan on what we do. I imagine many of you are dealing, our entire state here in the state of Kansas just went into an order that if anybody comes from a designated hotspot, New York, the state of Florida, 4 counties in Denver, Los Angeles are identified ones so far, you're supposed to tell that employee, if you went to one of those places recently, you can't come back to work for 14 days. That's what our governor ordered for all employers in the state of Kansas. So what do you do in that scenario? What does your employee do in that scenario? And again, we're about to start covering that in some detail as we go forward. Jill, if we go to the next slide, the shelter from home orders. For those of you who have been put in one of those, I'm going to talk briefly about that so that you can have that covered. In most places, these shelter from home orders have an essential occupation or essential employer exception. Given the nature of the group on this call, I don't know whether you will be covered on it or not, and whether your workplace will be or not. They're all different. But you do need to have a plan based on the laws that will kick in, that are already in existence, and those that will kick in April 1st. What will you do with your employees? Will you lay them off or furlough them? I've got a huge number of calls from clients about, should we do a temporary layoff or should we do a furlough? And as Jill and I will tell you, that those terms really have very, very minor legal significance under the existing laws. The primary area where that has significance is going to be with regard to your health insurance. Many of your health insurance providers, if you send your employees home and they're laid off, would normally say, in a normal world, say that you would have to issue COBRA to those employees to cover their insurance and then go through the COBRA process. However, many insurance providers are allowing companies to, on an emergency basis, amend their plans and say, if you furlough your employees and keep them active on the payroll, then we will not consider that a COBRA event. So if you're in the unfortunate situation where you are going to have to put your employees out of work, and many people are doing that, how you decide to structure that is something you're going to have to think about. It is primarily a health insurance issue because the other issues related to unemployment and what they're on do not make a difference what you call it, whether it's a layoff or furlough. How do you provide customer coverage? How do you control access to your facility? Our building is on lockdown due to the fact that our city is on lockdown, and we've got to have special access to get in, to get our mail, whatever. If we go to the next slide, subsequent waves or Gophers, however you want to call it, how are you going to staff during the crisis? In just a few seconds, I'm going to be covering the new laws that are out there. These new laws are going to have a lot of your employees potentially not working for a while on a paid leave of absence. If that occurs, how are you going to staff? That's something you're all going to have to be thinking about if you're covered by these laws, and I think many of you are. On the flip side of that, if you go layoff, I just talked about that. How can you maximize the government funding opportunities? One of the core aspects of this new CARE Act that is going to be passed is a $600 increase to unemployment benefits to try and get anybody who is laid off as close as possible to their normal earnings. Is that something you will take advantage of, or will you try and take advantage of the CARES Act element that says, if you keep your employees employed, we'll pay you your salary and your wages for 4 months? That's going to be a decision you will have to make based on your business. If you can keep your business operating during this process, despite hardships, even if you're not making any money, your real costs are payroll and rent perhaps, so you can keep your businesses operating, you might want to go the CARES route and get that small business reimbursable loan, or the government covers those costs. If you really can't, and you can't keep operating through this, and you lay everybody off, then at least there's going to be value to your employees in terms of the enhanced severance or enhanced unemployment benefits that are available. So these are the things that you're all going to be considering. Again, Jill and I are going to be walking you through these items starting right now. So Jill, if we go to the Families First Coronavirus Response Act, I'd like to start on this slide, and I'll walk it through for everybody. This is a brand new law that kicked in just last week on Wednesday. That's when it was passed. What the law provides for is a floor that all covered employers have to do for their employees. You could do more, but as you will hear, you won't get reimbursed that cost from the government. What they did with this law is make certain aspects of the law, for those of you who are fewer than 50 employees and have never had to comply with the Family and Medical Leave Act, you will have to comply with this part of it. We're getting DOL regulations, so Jill and I are going to try and cover this today, but keep in mind the Department of Labor is going to issue official regulations over the next week. Last night, they gave the Q&A that is referenced in here with guidance to that and an employer fact sheet to help you guide this. That is that website I referred to above you can click to for more information. So that is the basics of the law. Here's where it gets more important. It does not become effective until April 1, 2020. This law is not in place now. So if you have employees that are taking time off because they've been exposed to the virus or whatever, everything we're talking about does not apply to them now, and it is not retroactive to them once it becomes law. It just says what you have to do going forward starting April 1. In addition, the law sunsets. It ends on December 31st. So everything we're talking about now is a gopher and a snake that begins April 1 and ends on December 30th. And it will apply to leave taken during this period. So let's talk about what this is. Jill, if you could go to the next one. The first bullet here should say members with fewer than 500 employees. That's who's covered by this law. If you've got 5 employees, if you've got 499 employees, if you've got 1 employee, you are covered by this new law and have to do what this new law requires. If you're part of a corporation that has several different subsidiaries or several different entities, they will look at all of those various entities possibly under these legal tests that are out there that we do not have time to go into today, but that are out there to determine whether you put them all together to see if you have more than 500. If you think you might fall into that group, you need to immediately be talking to your employment law counsel, because whether or not you're covered by this law is a huge deal. If you are covered by this law, you have to provide this benefit, and you do get reimbursement from the government for the cost of doing so. If you are not covered by this law, you are not covered by this benefit, and you do not have to provide it. And if you choose to do so anyway, you will still not get reimbursement from the federal government. That will be at your cost. So that is a huge deal if any of you are part of a bigger business or a bigger business yourself. What does the law do? There are 2 very, very separate things here. One is going to be paid FMLA leave for the one qualifying event that's covered. The other is going to be paid sick days for 5 different events that are covered, each of which we'll walk through in a second. If people take leave under this law, then they are going to get job protection. We can't fire them, and we have to give them their job back. The great news, all of the costs of this, for this paying this leave, are 100% reimbursable from the federal government. It is designed so that it will not cost you anything. There's going to be a posting requirement that should be available on the DOL website tonight that you all have to download, and you are supposed to post wherever you post your normal employment posters. The rest of the law provides for free testing and enhanced unemployment grants to the states, as I previously said, to help cover that. So let's quick jump into this. The next slide is very quick. The Department of Labor does not want to play hardball with us on this. They're saying for the first 30 days that law takes into effect, they are taking a non-enforcement position, which means they're not going to take complaints. They're not going to come out and investigate you if they think you're doing it wrong. They want to help you comply with it. So that is the first bit of good news we've got from them. So next slide, small employer exemption, how to apply. There is an exemption where you could get yourself so you are not covered by this law if you fit the requirements. First off, you have to have fewer than 50 employees. If you have more than 50, you can't really get out. Second off, complying with the law would have to jeopardize the viability of your business as a going concern. That is an extremely narrow exception, particularly when you realize that the costs are 100% reimbursed by the government. So for you to apply that exception, you're going to have to somehow say that the absence of a certain number of employees would place your business in serious jeopardy of being able to go forward. So this is going to be an extremely narrow exception that we see very limited number of employers be able to take advantage of. What you're looking at here, Jill has actually inserted the Q&A from the DOL guidance that came out last night. That is really all we've got, folks. There's just not much more guidance on this yet. But if you're looking to take advantage of that, again, talk to your counsel as soon as possible and before April 1st so that you can see if this might be an option for you. Next slide, emergency paid FMLA leave. Who is eligible? You have to have been on the payroll for 30 days. So a brand new hire would not be covered by this aspect of the law, the emergency paid FMLA leave bucket. It's going to be different when we talk about the emergency paid sick days bucket. But for coverage under this law, they just have to have worked for you for 30 days. For this law, they get 12 weeks of job protected leave. That's what I talked about. You got to let them go on leave. You got to restore their employment. During this period of time, if they've already taken some other FMLA event, if you're covered by the FMLA, those do count towards the total number of 12 based on the guidance we've received right now. Highlight this in your slides because that is something we're expecting further guidance from the Department of Labor on. We do believe all FMLA events are cumulative, including the new ones, such that you couldn't take 12 weeks for the birth of a child and then now 12 weeks paid for a qualifying event. But that is something we are awaiting absolute assurances on from the federal government before we 100% say that. There is a waiting period for this new paid benefit. You cannot, the first 10 days are unpaid, and then the next 10 weeks are paid. The pay rate for that is not less. Here is what you are going to have to pay your employees for. This is the number you've probably been waiting for. It is 2/3 of their usual pay for the normal scheduled hours for that employee. So if they're full-time, normally that's 40. If they work a lot of overtime, however, that could be more. They could get more than that for these weeks if they work on average of 50 hours a week. The flip side of that is if they work part-time and they only work 20, then they would get 20 hours times 10 weeks or 200 at 2/3 their normal pay. There is a daily cap. The daily cap on this is $200 per pay period. So if you've got a really high-paid individual where 2/3 of their pay would be more than 200, the max you'd have to pay is $200, and then the total cap for an employee is $10,000. Here is another big yellow magic marker moment. We cannot force them to substitute or take other paid accruals before they take this leave. So if you've got a vacation or a PTO system that would otherwise you apply, you cannot say you've got to burn all of that before you go on this paid leave. They are allowed to retain that time in their bank. If they want to use it to cover those 2 weeks unpaid, they can, or they could go apply for unemployment. That's one of those things you're going to have to be thinking and balancing about, but you can't force them to. So now for the big kicker, the next slide. This is the one thing that qualifies people for this time off. If an employee is unable to do work or telework, if you can have them doing their work at home, you can say, no, I want you to work from home. But if they're unable to work or telework because their son or daughter under the age of 18 is home because their school closed or their daycare or wherever they got their child care before these became an issue closed. So I'm in Kansas again. My businesses in Kansas City, Missouri, but I live in Kansas. The state of Kansas has closed the schools for the remainder of the school year. If after April 1st you live in Kansas and your school is closed and an employee comes to you and says, I've got a 6-year-old, she's home, I can't keep her at school, I need to take paid FMLA leave, and you don't have the capability that she could work from home, then that employee would get these 12 weeks under this new law. That's what this law is designed to cover. So that is the new paid FMLA leave event. If you go to the next slide, for many of you who are visual rather than textual, Jill and I tried to lay this out into a flow chart that you could all follow and see. If you want to print this out, and it's difficult on the slide, I've had a few people in the prior presentation say that, we can get you this in a PDF that is much easier to see, where you could print it out and see it if you want to distribute this to your colleagues. But this slide doesn't add anything to what I just said, other than it is another way to look at it if you're better at looking at things that way. Next slide is the emergency paid sick leave. This is the second bucket that I just referenced. It is almost totally different than the first one, so bear with me here. Effective date, same date. It will apply only to time taken off after that date, not before. Still applies to employers with fewer than 500 employees, so that is the same. What this one does is eligible for all employees, not those that have worked 30 days. Everybody is eligible for this on day one. You have to provide this. What you have to provide here is 80 hours of paid sick time. So the way to be thinking about this, and the way the law said it, is 12 weeks of paid sick leave, or paid sick hours, and here this is or paid FMLA. Gosh, I've already confused it. 12 weeks of paid FMLA versus 80 hours of paid sick leave. That's the two differences. Here's the other big difference. Employees, if they need to take off for a qualifying event for this, they get their regular rate of pay. So if they're paid $500 a day, they get that amount. The cap for this leave is $511 per day. So they get their regular rate up to $511. If it is for their own illness, and I'll break this down in a second on the next slide. If it is to care for a family member that's ill, then the same $200 per day as under the paid FMLA applies. 2/3 up to the cap of $200 a day, or the total cap of $200. The same prohibition applies. You cannot make them use accruals before they take this leave. They get to take this first and save their accruals if they choose to. It also applies that they cannot carry over hours into 2021. If they do not use this paid sick leave during this period, then those hours are gone and they do not roll over in the next year. This is a one-time event to try and get us through this crisis. So really quickly on the next slide, these are all the things that a person could pay to take this 80 hours of paid sick leave for. These are the qualifying events. If the employee is subject to a federal, state, or local quarantine or isolation order because of COVID-19, I am currently in that in Kansas City, Missouri. We are on lockdown in our city until the 3rd week of April. In that case, once this law becomes effective, employees can take 80 hours of paid sick time at their regular rate of pay for this period of lockdown that we are under. So that's item one. Item two, if one of your employees say they've been advised by a healthcare provider to self-quarantine due to COVID-19 concerns. So that means right now we are monitoring this one, by the way, because that is not particularly clear. Does that mean a person who currently is suspected or thinks they might have COVID-19? Or does that mean somebody who is really concerned because they're in the high-risk category? I believe, and we'll get more guidance on this, that it applies to somebody who is in a high-risk category and just can't come to work. And their healthcare provider says, look, you've got COPD, you're 70 years old. If you get this, you have a good chance of not getting through it. I am advising you to stay at home. Then that employee would be eligible for these 80 hours of paid days or whatever it may be, again, based on that formula. The third bullet is if the employee is experiencing COVID-19 symptoms and seeking medical diagnosis themselves. They've got a fever, they've got a cough, they've got a shortness of breath. They want to take the afternoon off to go and talk to their doctor about this thing and hopefully get a test if it's available in their area. That time off would be counted for this, and you could pay them this paid sick leave and then get reimbursed for that cost from the government. Those first three bullets are all bullets that are subject to the $511 cap. Those are for the employee's own situation. The next 3 bullets, if they're taking leave because they've got to care for a family member who is out there to self-quarantine. I apologize for all these calls. I keep getting a lot of people calling. I turned it off now. So if they're caring for somebody who has been quarantined, or if they're caring for a child, like under the paid FMLA leave, whose kid has been kicked out of school or daycare. And then there's this catch-all at the bottom that we'll wait and see what the Health and Human Services people say are going to be covered by this catch-all. But if they have to take time off to care for an individual subject to these quarantine that is a family member, whether it's a child, spouse, parent, then they would get these paid sick hours as well. If we jump to the next slide, once again, what Jill and I tried to do for everybody here is do this in kind of a format that is more visual, that would hopefully cover people and help you there and take care of that. So no new data, just in a different format. If we go to the financial assistance, I am really close to being done, and I'm going to pass it to Jill to cover our next time for the 40 or 50 minutes we have left. How are you going to get your money back? This is 100% refundable. Every penny you pay in terms of a wage for somebody to cover this time off, the federal government is going to pay you back for. You will do this by deducting the amount you pay in leave from any payroll taxes you owe when you submit your payroll taxes. That means there's no lag time. You're not going to have to wait and get a check from the IRS for the most part. If, however, the amount you pay out in leave exceeds what you would owe in a payroll period for that time, then you can seek reimbursement for that extra amount from the federal government. So that is these 2 laws in a nutshell. And I'm going to move on and cover this last slide, and then Jill is going to cover the rest of our program. And this last slide, the huge thing you all need to write on it is, this hasn't passed yet. I believe it may be passing as we speak the Senate. I believe the president will likely sign this thing tomorrow or at the very latest, hopefully Friday. But what this thing is designed to do is to give forgivable loans as it applies to employers. There's a lot more out there under this law in terms of direct cash grants and employees getting paychecks directly from the government and $1,200 and $2,400, all of that. As it applies to people on this call, the way it was written before and hopefully passed would mean up to $10 million of your payroll and your rental expenses or your mortgage expenses to keep your business open would be 100% reimbursable from the federal government for a 4-month period. That is a huge amount of money that all of you might be eligible to get without any obligation to pay back if the law got passed the way it was written. That amount that you could get has to go to cover your rent and payroll costs, as I said, and it starts getting reduced by a proportionate amount if you've laid people off. So if you had 100 employees and you laid 50 off of them and you're not bringing them back and covering them, then the amount you could recover from the federal government is reduced by 50%. So keep in mind, this is designed to help employers stay open and keep them on the payroll so that the minute we are past this gopher and the snake that is the COVID virus, you're immediately ready to go back to work and the economy starts humming again. That's why the government is willing to give you this money. So watch that closely. Be aware that is going to pass hopefully in the next couple of days. Contact your small business association and your regular counsel or Jill or I when this thing gets passed if you need guidance, and we'd be happy to help. So I am done, and I apologize, Jill. I did go longer than expected, but it's taken longer to summarize this stuff. That is the new laws that have been passed. Jill is going to take over and cover all of the questions that people like you are asking about how do we deal with the current laws that are out there. So with that in mind, Jill, I'm going to pass it to you and be quiet until we get to the question section.
All right. Well, thank you. And there's a lot to cover. And we've still got a lot to cover. I will cruise through the remaining already existing, long time existing labor and employment related laws that might be implicated during this pandemic and highlight the issues for you. Each of these laws could warrant a full 60-minute webinar on its own. So we will not have an opportunity to really delve into all of the ins and the outs, but my goal today will be, and as Tim's was, to let you know what the significant issues are so that you can just be aware of them and be alert as you're making your plans. A common question that Tim and I have been getting from our clients is, does the WARN Act apply? And the WARN Act covers employers with 100 or more full-time workers and it generally requires 60 days notice before a layoff or a shutdown in business that affects generally 50 workers at a single site or a third of the workforce at a single site of employment. Know that there are also in some states what we call mini-warn laws that also apply. And also for some of the short-term furloughs or temporary layoffs that you might be making, if you intend to bring people back after a shutdown in business, for example, the Federal WARN Act might not apply at all. The Federal WARN Act does apply to some temporary layoffs and business shutdowns, but not if they are for fewer than 6 months. It only applies if the closure or layoff exceeds 6 months in duration. So hopefully you will not be in that position, but just be aware, especially if you're in that category with 100 or more full-time employees, that you might have some notice obligations. There are some exceptions in the Federal WARN Act for natural disasters or for unforeseen business circumstances that might cover this pandemic. But that doesn't necessarily excuse an employer from complying with the 60-day notice requirement you would otherwise have to give. It might reduce that requirement. We generally advise our clients to go ahead and provide the notice when they know it's coming if they're covered by WARN, even if they think that one of these exceptions applies for a natural disaster or for an unforeseen business circumstance. So take a look at this. The laws may change. California, for example, just suspended its state WARN Act because their state law in California does not include an unforeseen business circumstances exception like the one I just mentioned for federal WARN. Be aware of that. Other provisions, other legal provisions you need to be aware of if you're laying people off or you have to close or suspend portions of your business. Tim mentioned the COBRA notice that's required for triggering events to give former employees, notice of their rights for continuing coverage under group health insurance plans. If you're unionized, I don't know if anybody on the call is, but there might be a collective bargaining agreement that affects you. We talked about the state mini-warn laws. Discrimination laws. These are the laws that prohibit discrimination based on race, based on national origin, based on disability, age, and other protected factors. Be sure you're alert to those if you're selecting which individuals might be impacted by a reduction in force or a reorganization. And then finally, we're seeing a lot of activity at the state level with the states relaxing or expanding their unemployment benefit provisions in response to this epidemic. One of the biggest things we're seeing is a waiver of the normal waiting period. In North Carolina, that's a 7-day waiting period that's waived if the loss of work or reduction in hours is related to COVID-19. So just be aware of what your state unemployment laws are, what they say, and what changes might be going into effect as a result of any executive orders relating to the pandemic. Also, the CARES Act, the one that we think will pass in the federal government within hours or days, hopefully more like hours, does provide for a huge expansion of the unemployment benefit system nationwide. It's been called by the legislators unemployment on steroids, so watch that space too. Under the Fair Labor Standards Act, if you send people home due to a business decline, you'll want to look at the Fair Labor Standards Act and any state wage and hour laws that might apply. It differs, how you handle this will differ depending on whether an employee is exempt or non-exempt. Basically, if you've got non-exempt employees who are working less frequently, working less hours because of a business slowdown, they're only paid for their hours worked. If they're going on to a furlough or a steep reduction, you might want to consider how you can dovetail the existing time off or paid time off with unemployment benefits that might be available. For exempt salaried employees, however, remember that we're not permitted to make deductions from their salary based on the quality or the quantity of their work. So generally, they still must receive their full salary if they're working at all during any given work week. We are able to not pay or exempt, even with an exempt employee, we're entitled to make a deduction from their salary if they do not work at all during a full work week. But if they work at all during that week, they're generally required to, we're required to pay them. We may, under the wage and hour laws, require an exempt employee to use accrued leave or vacation time on specific days. There also are some exceptions if we ask for volunteers due to a business slowdown or insufficient work. If we ask for volunteers for people to take personal days off and an exempt employee volunteers, and it's a completely voluntary decision, we can make deductions from the salary on a full day basis if they take a day off that's a personal day, not a sick day, not because of illness. So just be aware of those provisions. Consider other options. As Tim mentioned, a number of our clients are considering furloughs, reduced schedules. You can always reduce someone's salary or their hourly rate of pay. If you do that, just be sure that you comply with state laws. I know many of them require, North Carolina is one of them, that requires certain advance written notice before a reduction in pay or salary. Remember that traditional FMLA still might apply to a COVID-19 related condition if the requirements of traditional FMLA leave are met and if you're among the employers who are covered. And time off taken by an employee for the purposes of avoiding exposure to COVID-19 is generally not protected under traditional FMLA, unless the existing medical issue is present, or one of the new qualifying events for paid leave applies. There also are some implications for the Americans with Disabilities Act. Generally, testing positive for COVID-19 is probably not an ADA-covered disability in and of itself. But if somebody's got some comorbidities, if their individual health situation means that they develop other conditions such as pneumonia or asthma as a complication or exacerbation of the COVID-19 infection, then they might be considered disabled. As Tim mentioned, the EEOC has issued some new guidance available online that covers what information an employer may request from an employee calls in sick in order to protect the rest of its workforce during the COVID-19 pandemic. Remember that ordinarily the ADA would restrict us as employers from asking medical questions or requiring medical examinations. But during this pandemic, the EEOC has issued guidance affirmatively permitting employers to make certain disclosures or ask certain questions or require certain examinations. We still have to treat all information about employee illness as a confidential medical record, separate from the personnel file to comply with the ADA. And of course, we shouldn't be disclosing employees by name who might test positive, for example. But the EEOC has affirmatively blessed the practice of taking the temperature of employees, for example, during a pandemic, since a high temperature is normally one of the indicators, but not always one of the indicators of an infection. So again, be sure to check the EEOC's updated website. And be sure to consider any discrimination issues. We've heard some people talk about this as a Chinese virus, and that's something that the agencies have become concerned about. Both the CDC and the Department of Labor have given advice about targeting people of Asian descent related to this pandemic. Workers' compensation concerns. There's potentially a workers' compensation concern if an employee contracts COVID-19 while working, but the problem here is going to be proving causation. It's very difficult to prove somebody contracted COVID-19 at work, especially if they're not working in an industry with a high risk of exposure. And then finally, I'd like to cover OSHA briefly. There is no specific OSHA standard addressing airborne viruses or diseases like COVID-19. Instead, we look to the General Duty Clause, which requires each employer to provide a safe work environment, a work environment that's free from recognized hazards that are causing or likely to cause death or serious physical harm to employees. OSHA has developed a great new publication that's available on one of the websites that Tim listed earlier. It's called Guidance on Preparing Workplaces for COVID-19. OSHA developed this in conjunction with the CDC, and it contains great guidelines to identify the risk level. OSHA has broken down the risk level of contagion by industry So the very high risk of exposure would be, in healthcare industries, places where people are exposed regularly and in close contact with infected individuals. Most of the people on this call would likely be in a retail setting in a low or medium risk category. This is all just advisory and informational. OSHA hasn't issued any new legal obligations. They have provided some guidelines for abating and minimizing the risk, and Tim's mentioned these earlier, and for feasible means of protection. And that would be establishing work rules or practices, communicating the rules, and developing a process for recording cases and isolating people who test positive. There's a question as to whether a COVID-19 infection that's developed at work or believed to be developed at work is recordable as an OSHA injury. We've provided some guidance here in the slide. If an employee is exposed to the coronavirus in the work environment, is diagnosed with COVID-19 by a healthcare professional, and the case results in medical treatment, restrictions on work activities, days away from work, loss of consciousness, or death, then the case is recordable. But again, we've got the same causation issues we had with workers' compensation. The infection has to be more likely than not that the work environment either caused or contributed to it. And it's probably not going to be work-related, especially if an employee either lives with or is coming to close contact outside of work with somebody who's infectious. And now that we've got community spread happening and virtually, I think, most areas of the country, I think that causation element will be even less significant. And I also think OSHA is going to have bigger fish to fry than worrying about reportability or recordability of an injury. There is some protection under OSHA for people who engage in and exercise protected rights under the statute, and that can be refusing to perform hazardous work. So an employee who refuses to work because the employee is concerned about contracting the disease, arguably, in some industries and in some circumstances, might be protected from discipline or discharge or termination. A plan to reasonably protect the employee from exposure is your best defense if you're confronted with a situation. We're seeing this situation arise more frequently in the healthcare context, but it could also arise in retail. In order to show that there's been retaliation, an employee has to first ask the employer to eliminate the danger and show that the employer failed to do so. And the employee has to have refused to work in good faith, and there has to be both an actual danger of death or serious injury and also a perceived risk. So not only must the employee actually be afraid of it, but that fear must be reasonable. A generalized fear of contagion is probably not going to be enough. But if you do have somebody that comes to you and raises concerns about what you're doing as an employer to protect them, remember this and remember to listen, hear them out. And if you're complying with these OSHA guidelines that are based on the CDC guidelines, you're generally going to be in good shape there. That's a solid basis to be operating from. And with that, I'd like to move to questions, recognizing that there may be as many questions or more questions than there are answers, but Tim and I will do our best.
All right. First of all, on behalf of everybody in attendance, I want to thank both of you. That was some very, very powerful information, very informative. And we know this is going to be fluid and changing, but I hope that for everyone in attendance, that gave you a much better overview of this than you had previously. I will share with you that this presentation will be available after the call. We've got a lot of questions about that. And then going through a few of our most frequently asked questions for the call, and I'll start with the question that was asked most frequently, and that was if you can share any insight into how these laws and regulations will be in play with employees who are paid on a commissioned pay plan. For many of the folks in attendance here, they do pay on a commission basis. How will that fall into play as we address these new laws?
Jill, you want to handle that? You want me to handle that? How do you want to cover this?
Well, I mean, my initial thought on this is that for purposes of determining it, and Tim, this falls into the new laws, the paid leave, the calculation of the rate for the new laws for paid leave and the expansion of FMLA. But really the calculation of the rate of pay for purposes of determining how much somebody might be entitled to for paid leave, I believe will be assessed under Fair Labor Standards Act standards. Tim, is that your understanding as well?
Correct. Yeah, and with regard to what they're looking at is the regular rate of pay for someone. So what they're looking at there is if it's a commissioned employee, commissions typically are part of the regular rate of pay, and they've got varying compensation. So you would evaluate over a prior period of time how much they'd earn, and that is what they would get paid for that period of time that they're out on leave. So you would factor in all things that are part of the regular rate of pay, such as commissions, over a historic period of time, and I'll have to double check. I think it's looking back 6 months. And then that is the amount you would pay that person for the amount of time they leave, right?
Fantastic. And we'll note that as a follow-up question to seek more information for you on that. Another question that came in several times: how should companies handle employees' share of health premiums while they're laid off or on furlough?
Some of that might depend on what your health insurance plan says. As Tim mentioned, a number of plans will contain language requiring somebody to be actively employed, and then the plan itself will define what that means. Under the FMLA expansion, I believe that most health insurance plans do provide for ongoing coverage under the plan, even if somebody's not actively employed, as long as they're on approved FMLA leave. So that already would be built into the plan. My understanding is that the new CARES Act, at least the iterations of it that were made available to us as they were making their way through Congress, will address this question of health insurance coverage while somebody is furloughed or out of work. So I really hope we're going to get some more answers on that. But Tim, do you have anything to add? Or you also mentioned, Tim, that a number of insurance carriers are voluntarily waiving the active work requirement.
Yeah, I agree with what Jill just said. First off, is this is one of those, we can give you advice today, but that could change with the CARES Act. So before you would do anything, let's wait and see what that is. With regard to if you've already laid them off and what do you do, it is primarily a question of your health insurance and what your summary plan description says. So here is what I've talked to dozens of employers that asked that exact question over the last week. Contact your insurance provider. Ask them if exactly the question you ask us. We've had people that are laid off. We would prefer not to COBRA them and prefer to just continue their health insurance if that's what you are planning to do. And that doesn't mean you're paying the full amount. You could do it whether they pay their share of the premiums or you pay their share, if you choose to and have the revenue to do that. But contact your insurance provider saying we would prefer to not have to COBRA. Does our current plan allow that, or do we have to change it? I had a client today that they changed their plan description today with their insurance company to change the wording to say, if an employee is quote unquote furloughed or laid off from our organization due to the emergency response through the period of end of May, they may continue without being COBRA'd simply by paying 100% of the premiums during this period, and you can do it that way. But Jill is right, that is primarily a question driven by your plan language, not necessarily the law.
Great answer there, and thank you for the clarity on that. Our next question has been asked by several of our attendees regarding team members who have already been laid off and have already filed for unemployment with the various packages that are and that may be coming. Is it advisable for those employees to come back on the payroll to enable these businesses to be able to best care for those employees through these new laws?
That is a fantastic question as well. And what that question assumes, and I will assume also for the purposes of the question, that this CARES Act is as I believe it's going to be, which is if you keep them on the payroll, you will get 100% reimbursed for that cost. If that does prove to be the case, then it probably is to your advantage and your employees' advantage to pull them back in and say they're not laid off. They would get unemployment for that period that they were out, but going forward then they would be back to where they're getting 100% of the compensation. You keep them engaged with your business. They're not laid off for the purposes of the health insurance. So this CARES Act is designed to resolve that particular situation. The flip side of it is if you choose not to pull them back in and you choose to leave them out there on unemployment, that is fine. They would draw unemployment, and they'll draw enhanced unemployment because the federal government is pouring more money into the unemployment in each of the states. But then you have the insurance question that somebody asked in the question before. So the CARES Act is very much going to impact on your decision. If it, as I believe it's going to be, it may be better for you to bring them back in. But that is obviously something that we won't know until this thing becomes law tomorrow or Friday.
Thank you for the answer there. And a follow-up question to that. If a team member has already been laid off from the business, does this impact the 30-day requirement that they must be on the team for 30 days in order to qualify? Does this have an impact there?
Yeah. Again, you guys have great questions here, so we do appreciate those. Yeah, if somebody's laid off, so you've already laid them off, under the Family and Medical Leave Act, they're not entitled to leave because they're no longer working and don't need to be off work to care for a child. They're already off. So in a very bizarre way, if you've already laid them off, they're not entitled to the benefits under these laws that I covered today in my portion. So yes, they would probably still be quote unquote eligible because they've worked for you for 30 days, but they would not be entitled to the benefits because they're not entitled to leave. So a lot of employers, now here's another catch, and this makes a difference. Some companies have notified their employees, we are not laying you off. We are putting you on furlough. And that means we are leaving you on the active payroll for us, and we'll only bring you in as we need you to work. That technically would be a situation where they are still active employees and very well could be in a position where they could request this paid leave benefit, whether it be paid FMLA leave or paid sick days. So I hate to be cagey on this call. Jill and I really want to try and answer your questions, but each of you might have had totally different communications with your employees. That hopefully provides the general answer. How you did it or how you want to do it might be specific to what you've said and done.
We appreciate the answer there, and we know there will be some more need for clarity, but that gives us a good idea. Several folks have asked the question, can employers require a doctor's note for any leave taken, or is that prohibited?
Jill, you want to grab that one?
The
I'm losing my voice here on my end.
This. I'm happy to. The EEOC has included a very helpful answer to this question in its updated guidance that's published on the website. Basically, if somebody's been out of work for a COVID-19 related situation, employers may, without violating the Americans with Disabilities Act, require a fitness for duty statement. But the EEOC has included a kind of a caveat to that, and that's that during the pandemic, our healthcare providers might not be in a great situation to respond immediately and, complete all these fitness for duty forms. So you might consider what alternative documentation would satisfy you. For example, if you've had somebody out who's had symptoms and gotten tested for COVID-19, is there a way to get a form or an email or even a stamp from the local testing authorities indicated that they actually tested negative, as opposed to going through the regular process of getting a fitness for duty statement through the healthcare provider? So yes, you may require some documentation, particularly if somebody's out because of their own illness, which is what you'd be looking for here. But bear in mind that it might be very difficult for employees to obtain that from their healthcare providers right now.
Very true, and good guidance there. For many of our attendees here, they have been designated as essential businesses in their areas and are under a form of local or state ordered quarantine. The question there being for the emergency paid sick leave, they are in that quarantine, but their business has been designated essential and they are remaining open. Would employees still qualify?
If there's,
I've
ahead,
lived
Tim,
through
I'm
that,
sorry.
so I've been in that situation, Jill. I don't know if you guys remember. I think your office there in North Carolina might be getting quarantined, or that might just be Charlotte. But I've lived in that scenario. So as I understand the question is, if you are in a state of or an area that is now under a quarantine, That situation would mean, as of April 2nd, keep in mind this law doesn't really kick in until April 1st, and then so the first day would probably be April 2nd. You would be, in that situation, your employees would be entitled to the paid sick hours up to 80 that's described in this. Your jurisdiction is under quarantine. That is one of the qualifying conditions that entitles somebody to pay. So yes, somebody would be able to collect those 80 hours of paid sick days starting April 2nd if you remain under quarantine for that period.
Okay, so that essential status wouldn't come into play there. I do have several.
Yeah, here's what essential status does for you in that situation. That just means you can legally have your employees come to work in your jurisdiction, even if you're in essential status, but that doesn't mean they are prohibited from taking leave under this law. You still would have to grant them the leave. It just means everybody who doesn't need the leave because they don't have one of the qualifying events has to come to work. So quarantine status doesn't mean your business shuts down and people are exempt from these new laws that we're talking about here. And I said that backwards. Sorry, I'm losing my train of thought. If you're in an area that has a quarantine status, but you have been designated an essential business, you can have all your employees come to work because they're essential. However, if somebody needs to take leave under one of these two buckets that I've talked about today, you would have to allow that employee to take the time off.
And that can become really difficult.
Don't have a oh, go ahead, Jim.
Oh, no, I was just thinking through the states, for example, the entire state of California that's under quarantine. Our city has a shelter-in-place order that was to be announced at 4 p.m. right when this call started. If you've got areas that are quarantined or sheltering at home and schools are closed, then does that mean that all of your workforce who have kids who can't come to work because they're, have kids who can't go to school and they have to stay home with them, get this type of leave? And the answer is yes, unless they can telework. Yes, that's a potential outcome, even if you're designated an essential employer or essential business.
Yeah. Yeah. I think I confuse people more. Jill said it better. The essential business just means you're allowed to continue operating and are still allowed to have people come to work. If they have a qualifying event under this law, that then would say that individual employee that had a qualifying event, even though you're essential, could say, I'm staying at home. And that is becoming very, very common in places like my area of the country where that question's coming up. Keep in mind, this doesn't kick in until April 2nd or April 1st. I keep saying one day. So that wouldn't apply yet, but it is going to rapidly be where that question is very relevant. If we go into a national quarantine, it'll become even more relevant.
Okay, and we're going to go through a couple more questions very quickly. I know we're already 15 minutes over what we had scheduled on time here, so just a couple final questions. This has been asked several times. FMLA, does that apply to part-time employees under this act?
Yes. Part-time employees get to take the leave under this new law. Now, they might get an incremental amount. So a part-time employee, when you say they get 12 weeks of leave if their child is kicked out of school or daycare, their 12 weeks of leave is going to be a lot less paid leave than somebody who's full-time because they only get the pro rata share. But yes, they're entitled to leave under this law to take the time off.
Understood. And this has been asked in several different formats. This is one that has a great illustration that I'll read. Is there a limit to the number of leaves an employee could qualify under the various ones mentioned today? For example, if a spouse were to get the virus and then a child got the virus weeks later, could that employee qualify for the same leave for 2 qualifying events?
Yes. The short answer to that is yes, there could be multiple qualifying events, but they don't get, for example, 80 hours for each qualifying event paid sick days. The sum total of the hours they could get under the paid sick hours is the max for the year. So the 80 would be the max. So if they get sick and need to take 2 days off, there's 16 hours for them, assuming they're full-time, and then they could come back to work. And then their spouse gets sick. They could take time off to care for their spouse or child. So multiple events, yes, but the multiple events are cumulative, and they don't stack on top of each other where you get 80 hours or 12 weeks for each one.
Fantastic.
There is one interesting wrinkle that Tim and I have discussed offline, and there's only one overlapping qualifying event between the FMLA expansion and the paid sick leave. And that's the situation where somebody can't work or telework because the employee has to take care of children who are home because of school or a daycare closed. And in that case, they might be able to stack the paid leave and the FMLA leave at 2/3 amount. In that case, the first 10 days or 2 weeks of leave, which would ordinarily be unpaid under the FMLA expansion, would become their 2 weeks or 10 days of paid leave. And then they would be entitled to the additional 10 weeks at 2/3 pay under the FMLA expansion. Is that consistent with how you understand it, Tim?
Yes. Yeah.
All right, and I've got
Yeah,
two.
I just to show you how bad it can be, I had a client who called me, the example I gave earlier on this call, although I've done 3 webinars, so I might have confused them. They just did have an employee that came back from 12 weeks of having a baby, taking leave under the Family Medical Leave Act. And now this employee believes that her child was kicked out of daycare. And I know it doesn't apply yet because it's not April 1st, but her child got kicked out of daycare because the daycare closed. And the question is, does she get 12 more weeks of paid FMLA leave right, to cover that? And the short answer we've heard so far is no. You've already used your 12 weeks and you can't take more. So we are getting unique questions like that.
So 2 final questions, and we'll, again, address many of the other questions after the call is over that will be able to be sent out by email to those who've attended. The final 2, the understanding here and the question that's asked for is there is no relief provided prior to April 1st. Is that correct? Or is there any kind of relief in this bill that's retroactive to the first day of the event? Or does everything kick in April 1?
Everything kicks in April 1. Any leave or time off granted prior to April 1 does not count. And so if you've given somebody 2 weeks off now and you decided to pay them for that just because you're a good employer, that will not count towards the time off they can take after April 1st.
Thank you for that answer. And our final question, this has been asked several times over the last few minutes. As we look at those qualifying events, for many of these folks, again, they have been designated as essential businesses. How do they address an employee that requests or demands time off just simply out of fear of COVID-19? They've not been exposed. They don't have a specific medical reason or a qualifying event based on the understanding from the attendee. How do you handle that person who simply refuses to come to work out of fear?
A generalized fear of contagion without any specifics or concerns about specific contact with people who've contracted the disease is generally not going to be protected under any of the laws that might otherwise apply. So, if you've got somebody who's got a specific fear of coming into work because, for example, they're going to be dealing with people who are known to be infected, that's usually in a healthcare setting, or in a retail setting, let's say they've got a specific fear of coming to work because they don't believe that the business is engaging in all of the protective measures or remedial measures that the business should be engaging in. A good way to address that as a practical matter is just, go over with the employee what the CDC is requiring, what OSHA has in its updated manual for COVID-19 for the industry and the risk category in which the employee is working, see if you can satisfy the employee's concerns. But you do have a right under the law to require somebody to work if their fear is just generalized. Tim, what do you think about, forcing somebody to work? I mean, they're not going to be entitled to any of this paid leave, right?
Yeah. We've got Jill hit the nail on the head there. We do have, and she covered the OSHA aspect of that, I think, thoroughly already. If somebody has a specific fear due to a specific risk in your workplace, there could be an OSHA element. I had a situation 2 days ago on Monday where a group of nursing home, and I'm not going to say the names, I obviously can't do that, a nursing home nursing assistants had a resident that tested positive. and they then said, we're not coming to work. And once you get past the horror of what that would be, that these people did not want to care for a resident because of their own concerns, you get to the legal aspect. As a group, they approached their manager and said, we're not coming to work. They had no health conditions. They had none of the stuff that Jill just talked about. They couldn't point to any particular safety risk other than the fact that the patient had tested positive. And the employer has done and is doing everything they can to protect them with the PPE and everything. What that deferred to then is the National Labor Relations Act. Can a group of employees under the law that provides for unionization, even if they're non-union, come forward and say, we're refusing to work? And the short answer to that is, if they do have a reasonable fear similar to the OSHA fear standard, they could. That general fear, just an unspecific or generalized fear, is insufficient, however. So cutting to the chase, I agree with Jill. I don't see any laws that would typically protect people, and you would be in a position to say, look, you're not in any protected categories. You don't have any protected risks. We desperately need you to be at work to get the work done that we have. We have been designated an essential provider. We need you to come here. If you choose not to, you could do things like count it as attendance and those kinds of items. Whether or not you do that with your own particular workforce, it's not just what you legally can do, it's what's best for your workforce. So that's a nuanced question. But legally, the way that question was presented, you could say, we need you at work, we expect you to be at work. If you're not at work, it will count it as an attendance issue.
Very good.
I know we're getting ready to wrap up on the questions. That might be the last one. So I would point out that the Department of Labor poster just became available. You can log on and get that printed out as of now.
And we will make that available through the nationwide COVID-19 resource pages as well, as soon as our team's able to get links up and available for those. Again, on behalf of Nationwide, we want to thank you for being here. We certainly want to thank both Timothy and Jill. So many great insights today, and I think we all are leaving this call a lot more informed than we were when the call began almost an hour and a half ago. We do look forward to some more webinars in the future as we continue to navigate through this together. For everyone who's in attendance, thank you so much for joining us this afternoon, and we certainly hope that you found this helpful. We will be in contact with you via email to get you access to the assets presented on the call today. We know that there's a lot more questions here that we simply don't have time to answer live, but we will be working on those as well. We thank you again for coming to join us. If there's anything that you need, please feel free. Reach out to any member of the Nationwide family. We stand ready to assist you. We hope that you are being safe. We hope that your teams and families are doing well. And we look forward to seeing and speaking with you again very, very soon. Thank you.